Hello everybody, thank you for tuning in. This is Dr. Patty, and what you're looking at is an x-ray of one of my patients this morning who's been straining to urinate for the past couple days with blood in her urine and definite odor of infection. So what you're looking at is a side view x-ray. This is her backbone, this is her tail, these are her hips and her back legs and her ribs. And there's her colon right here, and here is her bladder, and you could actually grab onto that bladder and feel those. So this is a radiographic diagnosis of bladder stones. So I'm going to turn on the light here and pan over to the collection of stones that we removed from her today. So this entire tray of stones came out of one bladder. This is about a 45-pound dog, and so that bladder is about the size of my hands cupped. Now, if you think of the bladder as a water balloon, the bladder has to stretch to accommodate the urine. But if you have all of these stones gathered all together in that bladder, at some point, all you have room for are stones. And so that's in the history when you have a dog who is now dribbling her urine. She's squatting every few minutes and she's straining. That's because these bladder stones are occupying all of that space. Now there's two ways to get them out of the body. One is to remove them surgically, which we did this morning, and she's in recovery. She's doing very well, and the bladder is very forgiving. It heals very quickly. The other way is to put them on a stone dissolving diet. So you start off with a stone this size and you put them on a special diet for about 4 to 6 months, and you're trying to dissolve them to where they can urinate them out to about this size. The problem being is a female dog has a very short, very wide urethra, so she can probably pass a bladder stone with a little bit of effort about that size. The male urethra is very long and it's very narrow, and if you have a bladder stone that size, it has the potential to get stuck, and then the dog cannot urinate, and that's a whole nother emergency. So very often it's just very quick to go in and retrieve all these. So how do these develop? Well, it usually starts with infection, and the bacteria attach itself to the surface of these stones, and with the chemical nature of the urine start to form a gel with the blood, the mucus, the bacteria form a gel, and over time you're going to get bladder stones. And as you can hear and you can feel, these are pretty heavy. So one of the things to think about is if you're noticing that your dog is straining to urinate, you're seeing a little bit of pink in that urine when you go to clean it up, or you have an unusual odor to the urine, those are signs that your dog may have a bladder infection, and it doesn't take much bladder infection to create a stone. So if you see that, it's time to get your dog into your vet and say, can we rule these out? Because recurrent bladder infections, antibiotics, it goes away, it comes back, goes away, it comes back. This is probably the reason why. So now that you know, you'll be able to be on top of things a little bit better. So thank you for tuning in, and today was bladder stones, and hopefully we'll have something exciting soon. So thank you very much, and we'll talk to you soon. Bye.